Hi guys, welcome back. So I recorded this whole thing and it did not save. So hopefully second time's the charm. I'm doing this all over again. But anyways, guess who got surgery? So what had happened was, for I want to say like 13, maybe 14-ish years, you may have noticed in some of my videos, you see a small bump like underneath my skin on my lower leg. It wasn't a mole or anything, but it was underneath my skin. For years, it was there, it didn't bother me, and it never kept me from doing anything. I could train, no problem. Walking, nothing. So physical therapy wise, I knew there's nothing musculoskeletal because I could do everything. It was just like tender to touch, and other than that, it didn't bother me. So I left it alone, but then I noticed over the past few years, it was gradually growing, and not just growing, but also increasing in pain and frequency. Especially if anything touched it, any pressure on it, it was pretty painful, and it was taking longer for the waves of pain to even go away. It got to a point where I knew I had to get it checked. So I went to the dermatologist. We both agreed it might be a cyst. Not common, but she said it needed to be removed. She scheduled me with a surgeon. I was calm going into it, but at the same time, apprehensive because I don't know what's coming out of my foot. I don't know what's going to look like. I was more curious than anything about what it was going to look like. Apparently was the only patient they've had who wanted to see them do the surgery on my leg. I don't know about you, but personally, I want to see what's coming out of my leg. Like, I want to see what you're doing to my leg. So anyways, they injected 10 cc's or 7 syringes worth of local anesthesia to the area, and then they made an incision and removed this thing from my leg. It was this gravel or pebble-sized thing. It wasn't a long surgery, but it definitely wasn't comfortable to feel them make the incision and kind of dig around and pull this thing out of my leg. Thankfully, it seemed to come out in one piece because whatever it is, if any piece is left in there, there is an increased chance of it growing back. According to the surgeon, it looks like a soft tissue lipoma. He doesn't think it'll grow back, especially since it came out pretty much in one piece, thankfully. So after that, he sewed up the incision, so I currently have stitches. The stitches will get removed next week. They wrapped it up, prescribed me an ointment to prevent infections, and instructions to redress it every day, keep it compressed. And it was funny because they wrote the prescription for this ointment. The medical assistant was asking me, like, do you know which pharmacy you want this to go to? And I was like, I don't know. I haven't even been to a pharmacy since I moved here. Like, for years, I've never needed to go to pharmacy for anything. So I don't know. So we're like Googling which pharmacy is closest to me out of the options they have. And we finally figured out which one it was. That was my first time walking up to the pharmacy and asking for anything. So that was interesting because I haven't been to the pharmacy probably since I had cellulitis. So in 2019, I actually ended up getting cellulitis in my right foot. I don't know where it was from. It could either have been from the martial arts gym that I was training at the time, or from a place that I went to for a pedicure once and never went back. But either way, I ended up getting cellulitis. My foot was swollen, red, very painful. Thankfully, at the time, I was working in a sports medicine clinic. A foot and ankle surgeon was a colleague of ours. We had treated a lot of his patients. So my boss sent me to get this checked out. My boss thought I broke my foot, but I didn't think so because it wasn't painful when I was weight bearing on it. But whenever I lifted my leg or changed positions, the pain was excruciating. If any of you have had cellulitis, you know how bad that pain is. X-ray came back clear, and lo and behold, I had cellulitis. So they prescribed me antibiotics. I was taking that and the swelling started going down. It was looking better. Until about a week later, until I found out I'm actually allergic to those antibiotics, and I broke out in hives. So, that was bad. So I couldn't take the antibiotics, and I was messaging the surgeon and sent him pictures of what my foot was looking like and the hives, and he's like, yeah, I need you to come in tomorrow. That next day, I was supposed to be going to a physical therapy conference with my boss. So I had to drive to this conference, and mind you, this is my driving foot, as I'm also seeing my foot grow in swelling. leave the conference early to go to this appointment. And the surgeon said that the infection had actually burrowed into my foot. So I watched them make the incision on my foot, have to drain out whatever was left of the infection, and stuff about 14 inches of shoestring with gauze into the incision. And since it was going to be the weekend and nobody could check on my foot, the surgeon packed up a box of medical supplies and gauze and gave it to me and was like, all right, here, you're going to pull out the gauze from your foot about 6 inches or so each day and redress it and rewrap it over the weekend. I mean, he trusted me based on my background and knowing I had already treated his patients and stuff like that. So like, okay, great. He gave me a different set of antibiotics and everything. Thankfully, that's all fine. My foot is fine. So back to present day, going into this surgery, I figured it wasn't going to be as severe as that. The surgeon was telling me that they wanted me to be sedentary for 2 weeks until the sutures come out. And if any of y'all know me, you know I don't do sedentary. So as a disclaimer, the decisions that I have made for my specific situation are based on clinical experience, physical therapy wise, my fitness background, and my own body awareness of what I can and cannot do, just to put that out there. Am I encouraging anybody and everybody to do the exact same thing? Absolutely not. This is purely based on my own expertise and experience. So that being said, I have not been sedentary. To be completely honest. Thankfully, the area where this incision is, it's not pulling on any of my muscles. There's soreness in the area because there's an incision and there's some scar tissue and some localized swelling, as you would expect post a minor surgery like that. But other than that, it's not painful when I'm moving, when I'm walking, or anything. There are small modifications. I don't want to say modifications, a couple small swaps that I've made in terms of cardio and lifting. In terms of cardio, previously I had been used to doing incline, like speed walking on the treadmill. Because of the area that it's in, for the first few days after surgery, it was a little bit more sore with driving because of lifting my foot to drive. So I swapped out the incline walking on the treadmill for Stairmaster because it would keep my foot more flat. But the thing about the incline walk on the treadmill was it hit two birds with one stone for me because I could not only get cardio done, but also get more steps done. So because I swapped it out for Stairmaster, Stairmaster is very similar in terms of like calories burned, but it was going to be less steps. So in order to hit my personal step goal for the day, thankfully, timing wise, it worked out because I just got a walking pad treadmill for home so that I can actually multitask, I can get work done and get my steps in to make sure I'm still hitting my goal without having to walk extra laps around our apartment, because that was what I was doing previously if I hadn't hit my step goal yet. In planning for that, I also upgraded my desk so the treadmill could actually fit underneath, because the one that I had previously was small and there was no opening for the treadmill to fit underneath. So that has helped. The one other swap that I've done in terms of training, I swapped out the glute med kickbacks. Because it's where the incision is, I didn't want to put any extra pressure. I swapped it out for an alternative exercise using the dumbbell. I'm still working my glute med, no problem. But overall, I haven't had to change anything about my lifestyle. I am still doing cardio. I am still lifting. I haven't needed to modify any weight or anything. Obviously, monitoring how my leg feels afterwards, how the incision is, all of that. But it has not resulted in more bleeding, swelling, or anything. Again, I am monitoring this on a daily basis. I am now 1 week post-op where some of the scar tissue and remaining swelling is. It is sore. There is some bruising over the past week or so. The bruising has been more evident just in that area. Other than that, just moving around, I don't really feel it. I actually forget that the bandage is on there. So other than that, I'm just waiting for next week when my sutures get removed. And then hopefully I'll be good to go. And hopefully at that time they'll also have the lab report to confirm that it's not something more dangerous that they'll have to go back in and take more tissue out. So fingers crossed, and I will keep y'all updated.